Hi guys, my name is Nash. I'm from Group 26, and today we'll be talking about how to prepare your patient for bypass grafting. So first and foremost, we need to understand what is a bypass grafting surgery. Coronary artery bypass graft, or CABG, is basically a procedure in which we will take a blood vessel from another part of the body, for example from a leg or an arm, and then we will attach it to the coronary artery, above and below the blockage. This new type of blood vessel, we call it as a graft, and the number of grafts that will be attached to your body depending on how severe your coronary heart disease is. And this procedure is normally conducted on patients with atherosclerosis or coronary heart disease. So as you can see in this picture, the veins will actually be taken from the leg and it will be attached to the aorta, bypassing the obstructed coronary artery. During this procedure as well, the patient's heart will be stopped for about 30 to 90 minutes and they will be placed under anesthesia. Now that you've understood it, you also need to understand and learn what are the things that needs to be done before the day of surgery. So normally, preparation days will take about 2, 3 or even 4 weeks before surgery, depending on the orders given by your doctor. Now during this preparation week, the doctors, they will actually begin to perform multiple tests on you. That includes blood tests. And the reason why they do blood tests is because they want to calculate the amount of blood cells that is present inside your blood. So this will be the first test that will be conducted on you. The second test will actually be the prothrombin time. The prothrombin time is a test that we also conducted by taking blood samples. And the reason why we do this is because we want to calculate the amount of time taken by your blood to clot. This is very important because in a bypass surgery, we will actually be removing your veins in your legs, for example, and then we will make a bypass at the aorta into the blocked coronary artery. There will be exposed blood, and it's very important to take into consideration the time taken for your blood to clot. Other than that, and also different types of blood tests will be conducted. This is to make an assessment of the working functioning of your kidney and also your liver. And the doctors will also perform an X-ray scan. So this X-ray scan is very important because it allows us to identify the location of your heart and also the size of your heart. And finally, another test, which I'm quite speculative about, this is a test that we call as the cardiac angiogram. Now you can correct me if I'm wrong. This test is basically a procedure in which we will inject a special type of dye into your blood veins, into your blood vessels, and this dye will actually circulate throughout your entire body, and it can actually help us identify which part of the blood vessels that has a blockage in it. So normally when in an artery there's a blockage or there's a constriction, the blood will flow slowly at that site. And from that site, we were able to identify the place that has the highest concentration of this dye. So when we do an X-ray scan, we can identify which part of the artery that has the blockage and how long it is, approximately, and how severe it is. So this is the procedure that we do in order to identify the location of the blockage before we perform surgery. Now, with that all being said, thank you for watching this video.